Every day for the past 2 years, long-term care providers have been at the epicenter of the COVID-19 pandemic, facing new challenges in providing care to Pennsylvania's most vulnerable population. Our nursing homes, our personal care homes, and our assisted living communities have remained on the front lines since March 2020. But those providers and our healthcare heroes haven't been able to do it alone. Over the past 2 years, members of the General Assembly and Governor Tom Wolf have allocated federal stimulus funds to long-term care providers so that they could meet the rising demands of COVID-19 expenses, hazard pay and heroes pay for staff, PPE or personal protective equipment, testing, and so on. These one-time payments were essential in simply ensuring the survival of long-term care. But in a state with one of the oldest populations in the entire country, Pennsylvanians need more than survival. They need sustainability. In every corner of the state today, long-term care providers find themselves in the exact same place, concerned about sustainability and what the future of senior care might hold, or if there's a future at all. Consider for a moment the workforce shortage that we've seen take hold across almost every industry. That shortage has reached a crisis level in long-term care. In fact, it's gotten so bad that it has disrupted our entire healthcare continuum. Providers have limited or even restricted new admissions simply because they don't have enough available staff to care for new residents. And let that sink in. Vulnerable senior citizens in need of care are being turned away. How can we stand by and allow this to continue? For nearly a decade, Pennsylvania hasn't met its obligation, its promise to our vulnerable senior citizens on Medicaid. Reimbursement rates haven't kept pace with rising costs, especially since March 2020. To be clear, Medicaid matters. And it's what will allow long-term care to be sustainable and successful in the years ahead and to combat this workforce crisis. Earlier today, Governor Wolf outlined his vision for his last year in office and his priorities for this year's state budget. Contained in the governor's budget proposal is an acknowledgement of the existing and ongoing crises facing Pennsylvania's long-term care providers, as well as their frontline staff and the vulnerable residents they serve. But the Medicaid funding allocated to nursing homes in today's budget proposal, $91 million beginning on January 1st, 2023, won't come close to covering the underlying shortfall, nor will it meet the demand for higher wages, more workers, and operational costs. It is simply not enough, especially for an industry facing an impending regulation that would raise our minimum staffing levels to the highest in the country. PHCA has proposed a $294.3 million investment in Medicaid reimbursement rates so that providers are empowered to invest in higher wages for their workers, to recruit new men and women to the front lines, and to meet the skyrocketing expenses that appear to be here to stay. It's just $35 per nursing home resident per day. Don't all our grandparents, parents, and family members deserve that? Today, we are extending an invitation to the governor, to the members of his administration, and to the members of the General Assembly. Over the next few months, join us in nursing homes throughout the Commonwealth. Meet with our providers, meet with our staff members, and learn why we have to make a substantial investment in 2022. A meaningful increase in Medicaid reimbursement can help providers sustain their operations, not just survive. This year, invest in long-term care, in our workers, in our residents, invest in the state's Medicaid program. Thank you.